Hello, welcome to the fifth video in this series. This week, I'll be discussing the different healthcare providers that you may encounter in the care settings that were discussed last week. The most common providers you will encounter are MD, PA, and NP. These stand for medical doctor, physician assistant, and nurse practitioner. So what's the difference between these providers? A medical doctor, or sometimes you may see a doctor of osteopathy, holds the degree of doctor. They attend 4 years of college and then 4 years of medical school and have another 3 to 7 years of training with other doctors. An MD or DO usually becomes specialized, meaning they learn to take care of a specific part of the body or a type of illness, such as a heart doctor or a cancer doctor or a pediatrician. After school and training, they are able to fully practice by themselves. They can diagnose, care, and manage illness. Doctors may also perform surgery. A PA, or physician assistant, holds a master's degree. They attend 4 years of college and then 2 more years of graduate school. During this time, they learn how to diagnose, care, and manage illness. A PA is usually more generalized, meaning they can work with any type of patient or any illness. They can do everything a doctor can, like prescribing medicine, and work under the supervision of a doctor. This means the doctor is available to the physician assistant if they need anything, but the doctor allows them to see patients on their own. They are an extension of the doctor. A PA cannot perform surgery, but they are allowed to assist the physician during surgery. An NP, or nurse practitioner, can hold a master's degree or a doctorate degree. They attend 4 years of college and then 2 to 3 years of graduate school, depending on the degree. Like an MD, a nurse practitioner is more specialized, meaning they work with a specific part of the body or type of illness. Like a PA, some states require a nurse practitioner to be under the supervision of a doctor, but other states allow them to work without supervision. In either case, they are educated and trained to make the same decisions as an MD. Next, we'll talk about some common words you might hear from your care provider. To rule out means that your healthcare provider wants to make sure you don't have a specific diagnosis. Typically, this is done when you have signs and symptoms of multiple illnesses, and your doctor is fairly certain one of them is not what you have, but they need to make sure. In order to do this, they will complete diagnostic testing. This can be any test that will show that you do or do not have an illness, such as testing for strep throat or the flu. Your vital signs are typically measured before you see an MD, PA, or NP. Vital signs are your heart rate, how fast your heart beats, your blood pressure, and how fast you are breathing. At a primary care clinic, this can help set a baseline to see when you are sick. An acute illness is when it is short-term, like a cold or flu. A chronic illness is long-term, such as diabetes or high sugar. A virus or viral infection, such as the flu or common cold, cannot be treated with antibiotics. A bacterial infection, such as strep throat, can be treated with antibiotics. Anti-inflammatory medicines, such as ibuprofen, reduce inflammation in the body, which is usually some swelling and pain in a specific area like a headache or a backache. Non-invasive means a procedure or test can be done without entering the body, such as through a cut or needle prick. A biopsy is when a healthcare provider takes a sample of the affected area to be tested. This is considered an invasive procedure as it is taken through a cut or a needle prick. Benign is used to describe if certain cells are not growing or spreading. Malignant is when cells are growing or spreading throughout the body. When a person has to stay overnight or multiple days at a hospital or facility, it is considered inpatient. When a person has an appointment and is not required to stay overnight or multiple days, it is outpatient. If a healthcare provider is giving a referral, it is typically to another healthcare provider who is more specialized in an area of practice, such as a heart or lung doctor. Lastly, some words you may hear in an emergency type setting. Edema is the medical word for swelling. An embolism is a blood clot, and tachycardia is a very fast heart rate. This can be determined when taking vital signs and comparing to previous vital signs. No matter the healthcare setting you go to, you may find any type of healthcare provider. These healthcare providers are highly educated and trained to provide the best care possible. The common words that were covered today are not an all-inclusive list, and if you are unsure of what your provider is talking about, remember you can always ask questions. They are there to provide you with care, and part of that is making sure you understand information about your health.